As we all know, the COVID-19 pandemic has put us all to the test, and this has been particularly the case with our elders and seniors in care. Very early on in this pandemic, we learned that our seniors and elders were most at risk of serious illness and death from COVID-19. Understanding this, we had to move quickly and decisively to protect our most vulnerable citizens. So to slow the spread of the virus, we made those most difficult decisions to restrict visitors in long-term care and assisted living, as well as putting in the single-site restrictions right across the province. Despite our efforts, families have lost mothers, fathers, grandparents, and every day this weighs heavily on us. I have spoken before about the negative unintended consequences of COVID-19, the emotional and the mental costs, and I know that for many seniors and elders in long-term care, the impact of being separated from their loved ones. You have sacrificed more than many. I'm also very heartened by the resiliency that so many have shown to get through this so challenging time, and I am very grateful as well for the many notes that I have received from people in long-term care and assisted living and from their family members. There have been many dark and anxious days, but today is a brighter day for us all. Easing restrictions in Phase 2 and Phase 3 here in BC has been about finding the balance of continuing to protect British Columbians while lessening the negative impacts. And now the timing is right to do the same thing for our long-term care and assisted living facilities. It is the coming together of a number of different things that we've talked about in the past. The resources that we have in place now, the fact that we do have access to a supply of personal protective equipment, the number of new cases in our community is low. What this means is that visitors will now be allowed for long-term care and assisted living facilities. To start, residents will be able to have a single designated visitor in a designated visiting area in each facility. We are going to start slowly, and as we expect things will progress well, we'll expand these activities as we have done with every other activity. And we will be monitoring this on an ongoing basis to ensure that we can expand access as soon as it's safe to do so. We have set province-wide requirements that outline how facilities can allow visitors in long-term care and seniors assisted living residents. And like many businesses that have reopened, these facilities will need to have plans and precautions in place. Visitation requirements for long-term care and for seniors assisted living facilities include a number of things. One, that facility can't be in an outbreak right now, and those outbreaks are decreasing. We do have, unfortunately, 5 that continue, including some very serious ones that we know about. So visits in individual facilities will resume once each facility has developed the required written safety plan and has that in place, and they're working, even as we speak, with our local MHOs to make sure those are in place. That will include designated staff who can screen everybody who comes in on entry and who can provide the guidance that's needed to ensure that visitors are able to do so safely. Residents will be able to have a single designated visitor in the appropriate designated spaces, and there'll be both indoor and outdoor spaces, and in some cases in single rooms. Visitors must bring and appropriately wear a mask, and they will be trained on how to do that after their screening on entry. Visits will also need to be booked in advance to ensure that the spaces are appropriate and that visitors can be spaced out through the day so that staff are able to manage as well. In addition, we are also looking at recognizing that people in assisted living are generally not as frail and able to direct their own care than people in long-term care. So what we expect is that people in assisted living will be able to have more freedom to go about having their visits outside assisted living facilities, but will need to follow public health precautions in doing that. In addition, we will have personal service providers, including hairdressers and barbers, will be able to come into long-term care and seniors assisted living facilities, but they will have to complete a plan, a safety plan, that's aligned with the WorkSafe BC guidance and provide it to the facilities. And it will include such things as how they will provide services safely and ensuring that the names of each person that they're contacted is kept in case of an outbreak. So these guidelines have been developed in consultation with many different parts of our sector, and they've been posted on they will be posted by today on the BC CDC website, and I encourage everybody to review those. Of course, we're all a little anxious because we know what can happen if we don't get this right. And it is something that has weighed on us and me as well over the last many weeks. But moving thoughtfully with care will give us the confidence that we need to move forward. And I know that this is what we can do here in British Columbia. It may take some facilities a week or 10 days to get all of the provisions in place, but I know they are working on it, and it will happen as soon as we can. So while I know everybody is very excited and anxious to see their family or their friends, please be patient for a few more days until we ensure that all the safety measures are in place. And I ask everyone to continue to do what we've been doing, to take things slowly and thoughtfully, to be cautious, to change your appointment if you are not feeling well. This will be so incredibly important. We know that communal settings with vulnerable people, that this virus can spread very quickly. So we need all of us to continue to follow our rules for safe social interactions and to ensure that we don't go if we're not feeling well. For residents of long-term care, I encourage you to limit your outings to essential activities, so things like medical visits. For residents of assisted living facilities, I also encourage you to limit your social interactions as much as possible, but to ensure that you do follow the rules for safe social interactions when you go out. And finally, I do want to let you know that we will review this on an ongoing basis, at least monthly. And as things progress in the community, as we continue to monitor cases, we will look at expanding how many people and how we can ensure that we are able to provide those essential care and visits to our seniors and elders. And to all of the seniors and elders in our care homes, thank you. This has been a difficult time for you, being separated from the ones you love, and for many people with things like dementia, it can be a very confusing and difficult time. You have shown a resilience, determination, and courage despite this challenge. As we move forward, we'll all do this well and carefully so that that sacrifice is not wasted. And we will also do it in the spirit that we have been all along. We'll be kind and be calm and be safe.